In a world where healthcare disparities too often leave the most vulnerable behind, there are those who rise to bridge the gap between compassion and care. One of such transformative efforts is the Rhythms of Compassion Network Benefit Music and Arts Concert, a bold initiative aimed at raising vital support for indigent patients at the Jos University Teaching Hospital, 𝐻, Plateau State, Nigeria, through the power of music, arts, and community engagement. Now, there are lots of persons at the forefront of this, and in this interview, we'll get to meet one of such persons. Let's get to meet you. Let's get to know you, sir.
Yeah, thank you. I'm Dr. Njem Josiah Minor. I am a consultant cardiothoracic surgeon. What it means is those who operate on the chest and all the organs that are within the chest. I'm also the chairman medical advisory committee of the Jos University Teaching Hospital.
Wonderful. Nice to meet you, Dr. Minor.
Thank you.
And let's get a brief history behind this concert.
Yeah, this concert was born out of the observation that we've had over the years. There are patients, who are so indigent that they can't even afford the basic of health services. And you watch patients dying, you watch patients carrying their things to go back home because they cannot afford basic needs that will provide the healthcare service they require.
Wow. All right. So who are the partners involved in this event?
The partners include the Jos University Teaching Hospital, the League of Friends of 𝐻, the Rhythm of Compassion, and then M.I. Abaga.
Wonderful. Is this a religious or political event?
Certainly not. We know that indigent patients cut across all strata of people, regardless of faith or lineage. And it cuts across. It's not a religious concert. It's a concert for humanity.
Mm. So what inspired this initiative within the hospital community?
The initiative was actually inspired as a result of our observation that we've seen our patients over the years having difficulty to afford even or access even the basic of healthcare services. And we have been very, very much emotionally touched by that. Therefore, we felt something needed to be done.
So how is the hospital leadership also involved in this?
Yeah, the hospital leadership is involved in this professionally. This is a hospital, and also emotionally.
Mm. So as the chairman of the advisory committee and the head of clinical services, Jos University Teaching Hospital, what is the biggest challenge that you see for indigent patients?
The biggest challenge we see is the inability to access or even afford the basic of care services.
Now, when you say basic?
Basic, I give you, like, sometimes a patient comes and might be 1,000 naira to register, might not have it. So this is as basic as that.
So why use music and arts to support medical needs?
Yeah, because music and arts moves hearts. And when hearts move, the hands also move. I give you an example. If you have an artist coming into Jos, the whole of the city will be agog. And people get excited, they get moved emotionally and all that. So music is a very, very strong tool to achieve this.
All right. So what does this concert mean to you personally?
This concert means, to me, it means hope. It means an opportunity to show our humanity. It means offering an opportunity to someone to live again.
So what are some of the short-term goals of this initiative?
Yeah, the short-term goals is basically to raise funds, pull funds from spirited individuals to be able to, reach out to these people that are indigent, so to raise funds.
All right. So how will these funds also be distributed to the indigent patients?
Yeah, the funds will be distributed. It's a system from the selection of those that are truly indigent, and the funds will be distributed based on need.
Okay. Are there any types of patients who may benefit immediately? Maybe pregnant
Certainly
women?
no. Yeah, certainly yes. You have children, you have pregnant women, and women coming to deliver sometimes don't even have the basic things to take care of, the immediate period of delivery. So children, pregnant women, you have other patients who might come unconscious. They don't have relations. So all these people should be able to benefit from
funds for care.
Yes.
Okay, wonderful. So how can will this also help to reduce patient discharge delays?
Of course. We've had patients staying in the hospital for quite a long time because they can't settle their bills. So if we have, a program that will help in this, yes, it will cut off the delay.
And what's the long-term vision for this initiative?
Long-term vision is to have a pool of funds that will regularly support these people. You and I know that we will always have indigent patients in our mix. There will be no generation that will be without us. So to pool funds that will on regular basis, come to the aid of these people who are indigent.
Okay, how will this initiative also inspire more hospital community partnerships?
Yes, we believe that when we stage this concert and this program comes up, it's going to inspire other, hospital initiatives to come up with programs that will help this in order geared towards helping our indigent patients.
Yes, and are there plans to make this an annual thing, or maybe biannual?
Of course, no. Yeah. So this is not a one-off event. For now, we'll look at it. Maybe make it annual or biannual. Yes, but certainly it won't be a one-off event.
All right. We do hope that it becomes a tradition of care and compassion, indeed.
Yeah.
So still looking at the long-term impacts now, how does this initiative also align with the values of Juth as a hospital?
Yeah, so it aligns very well with our values. Juth as an institution is built on 3 pillars. One is service delivery. Secondly is teaching and research. Now, this program is touching on one. They are actually interrelated. So if you pick service delivery, all right, so, our goal is to offer services to everybody. So there shouldn't be anybody who will come to Juth and have a challenge of accessing service. So this concert aligns with our value.
Do you hope also that this could spark a national model for indigent care?
Oh yes, oh yes, oh yes. Big things start small. Jos might be the beginning, and I'm sure the fever will catch up in the national, stage. That other people will come to learn from what Jos is about, has put in place.
Is there also a potential for a foundation or a trust fund?
Of course. If we want this to endure, if we want it to last long, then yes, we should, we're planning and looking forward to having a foundation. This will give it a more permanent, structure.
Okay. So, initially, earlier you had talked about the staff also being not just professionally, but also emotionally invested. How will the hospital staff benefit from this initiative? It
will relieve a chunk of emotional burden on them. By the time you have a lot of these patients accessing this, it has taken off the emotional. We are all humans. That you watch somebody dying, and you yourself appears helpless, because there's so many people that need that. So it will take off some emotional burden on them, and it also take off some financial burden.
So how will the Plateau public also benefit from this?
The Plateau public will benefit because all of us at one